Good evening, everyone. My name is Leslie Rattan, and I'm a psychologist and neuropsychologist working at Toronto Rehab, the University Health Network. And I'm pleased to be introducing tonight's session brought to you by the Canadian Concussion Centre, Prolonged Symptoms of Single and Multiple Concussions. We have actually been running patient support activities through the Canadian Concussion Centre since back in 2014, and we had been running quarterly 2-night in-person workshops for individuals and their families that were suffering from prolonged symptoms. We had run our last in-person session early in 2020, and unfortunately, due to COVID, we're no longer able to run the in-person sessions and have therefore transitioned to uh, online shorter sessions, such as the one that you're going to see this evening. We would like to thank LIUNA, the Laborers International Union of North America, the Ontario Council, as they have very generously been supporting our patient support activities to date and ongoing. I'm really pleased as well to announce that the tonight's session, and we had run one back in September that you can actually find on the Canadian Concussion Centre website, will be the introduction to a much longer series of sessions focusing on various aspects of treatment and different types of symptoms. And you will have the opportunity to hear from experts in the areas and also be able to ask those individuals questions. So once we have further details, we'll be circulating information on that, but we really look forward to bringing you more information on that. So, with regard to tonight, I'm really pleased to announce that we have Dr. Charles Tatter with us, who is a professor of neurosurgery at the University of Toronto in the Division of Neurosurgery at the Toronto Western Hospital, and also director of the Canadian Concussion Centre. We also have Dr. Apame Chirasi, who's a neurologist at the Krembil Neuroscience Centre, Toronto Western, and myself. And so the structure of tonight is we will have about the first 30 minutes will be myself and Dr. Chirasi presenting additional concussion education, focusing more on symptoms and managing those symptoms, as well as making some recommendations in terms of tools and strategies that you may be able to try out to see if they're helpful for your symptoms. And the last 30 minutes, we will be pleased to have Dr. Charles Tatter, who is going to answer some common questions that we often hear and that have been submitted by viewers. So just as a bit of a recap from the previous session, we know that coping with concussion can be a really frustrating process. We know that most people that have a single concussion make a pretty rapid and good recovery, but we also know, as you are likely aware, that there is a percentage of individuals ranging anywhere from probably 15 to 25% that will have longer lasting symptoms. And we usually characterize that as beyond the 3-month post concussion mark. And also, as you may know, because concussion is an injury to the brain and the brain controls absolutely everything about us, the symptoms that people can have after concussion really span the physical, the cognitive, the emotional, and behavioral domains. So we can really see a wide range of symptoms. Some of the symptoms that are particularly common are things like headache, sleep difficulties, fatigue, mood issues. And we're going to be addressing a number of these tonight with and speaking to you about the guidelines that healthcare practitioners currently follow when they're seeing individuals with these particular difficulties. You'll see at the top of the screen that there are guidelines which have been put out by the Ontario Neurotrauma Foundation as well as standards. And you can take a look at both of these websites and find information that can be really helpful in terms of sort of the current thinking around concussion and what, if you're looking for assistance, looking at the things, for example, on the standards website, in terms of the things that you should look for in a clinic if you are proceeding in that direction. I would just finally note that some of the tools that we will review aren't specific to any one particular symptom, but we feel may be helpful in addressing symptoms that you may be experiencing. And I'm now going to turn it over to Dr. Tarasi, who's going to talk to you about post-traumatic headache.
Good evening, everyone. Today I'm going to talk about some of the symptoms which are related to concussions and their management. One of the very commonest one is post-concussion headaches. About 30 to 90% of patients develop headaches, post-concussion headaches, and it's very common. And what is important about the headaches? First of all, we should know the nature of the headache, the frequency of the headache, the nature of the pain. Is it throbbing in nature, pressure type, piercing, and also the location of the headaches. All the history of headache can help us with the management of them. And it's very important to treat the headaches. But what is important about any type of headaches in general, and especially post-concussion traumatic headaches, is that we shouldn't use too many painkillers or analgesics, because we have a type of headaches which is called rebound headaches as a result of overuse analgesic, which are very resistant to treatment, and they can complicate the management of the headaches. And sometimes the physicians are confused that this is as a result of the analgesics or rebound headaches, or it's a headache related to the concussion. So it's important to keep a diary about how and document everything about the headaches, how often, how long, the duration, the location, and the nature of it, in order to help with the management. Of course, now there are some non-drug treatments, such as self-regulated and lifestyle strategies. And what is important about symptoms after concussions, that they are all in a loop and they can affect each other. For example, if someone has sleep problems, it can cause headaches. And as an example, for example, someone with headaches early in the morning after sleep, we should make sure that there is no sleep apnea, because sleep apnea can cause early morning headaches right after you wake up in the morning. Or some mood issues can worsen headaches. The headaches can worsen memory problems. So they are all in a cycle. That's why we really want to treat the symptoms and all the post-concussion symptoms. So there are some non-drug treatments, such as some massage therapy, biofeedback, relaxation exercises, and sometimes acupuncture can help, but most of the time the headaches needs to be treated with some medications, and there are different types of medications to treat the headaches depending on the nature of the headache. Sometimes the headaches, before some patients have a past medical history of some types of headaches, for example, migraine, and after the concussion, the migraine is getting worse, or a new type of headache, for example, a tension type of headache is added to the migraine, or sometimes because of some whiplash injury during the concussion, the headache is as a result of the neck injury, but the patients may feel it over the even temporal area, so over the temples, or over the temples or at the back of the head, but this is as a result of the neck injury. So it's very important to differentiate and to find out the reason of it. So we insist on treating the headaches, and depending on the type of the headache, we choose a different medication usually to treat the headaches. And what is important, if the patient has, for example, mood issues and headaches, we prefer to choose a medication that can cover both. Or when the patient have headaches and sleep problems, so it's better to choose a medication that can cover 2 or more symptoms in order to take less medication possible. Sleep-wake disturbances, it's very common again. More than 50% of people with concussion can suffer from sleep disturbances, trouble getting to sleep, staying asleep, hypersomnia, drowsiness, and sleep apnea even after the concussion for the first time. So it's very important to refer the patients who have some sleep problems for sleep study in order to rule out especially sleep apnea, which is a very common cause for cognitive problems and memory issues, and also the headaches in the morning, as I described before. So treatment depends on the type of the sleep disorder. Usually napping isn't part of the recovery in just a very acute phase of the concussion, first few hours, a few days after the injury, and we don't recommend napping later during the recovery period, as napping can interfere with normal sleep hygiene. As we all know that sleep can help detoxify the brain, so it's very important to treat the headaches, to treat the sleep problem, and good sleep can lead to a better immune function, metabolic control, low level of stress, and also higher creativity. So treatment is important, but what is important with sleep problems is that we don't usually recommend sleeping pills, because they can interfere with the cognition and the memory. And also what is very important about the sleeping pills is that usually the sleeping pills can cause tolerance, and you have to increase the dosage of the medication. So we usually don't recommend them for a long period of time. There are some non-drug treatments that can help, like cognitive behavioral therapy is having a good sleep hygiene, for example, avoiding screen at the time of the sleep, acupuncture, and some mindfulness-based stress reduction, exercise, doing physical activity, but not close into the sleeping time. And sometimes some medications such as melatonin can help with those who have trouble getting to sleep. Melatonin doesn't have those side effects of other sleeping pills because it's a natural hormone in the brain. And sometimes some supplements such as zinc and magnesium can help with the sleep. The other common symptom is fatigue. About 20-30% of people reporting at 3 months post-injury. So again, fatigue can interfere with physical, cognitive, psychological function of an individual or a person. It's very important to manage fatigue because it can interfere with the executive function, including problem solving or coping skills, and also it can increase the stress and all the symptoms related to concussion. Usually, it's very important to recheck the medications that may cause fatigue, and usually stress management can help with reducing the fatigues. And what is very important in fatigues is that gradually increasing the physical activity and doing some and also what the other important thing is that when you're doing physical activity and you feel fatigued, it's better to rest a little bit and restart it again. So pacing activities, what is very important. And mindfulness-based stress reduction can help with the fatigue cognitive behavior therapy. So it's usually non-medicational. And sometimes when we are treating the other symptoms, the fatigue also can be treated. They're all again in that cycle. Vestibular problems, including balance issues, unsteadiness, dizziness, vertigo, they are common after concussion, and they are one of those persistent and most consistent symptoms after the concussion. They can cause loss of balance, vertigo, fogginess, the different complaints. Again, they can be as a result of these symptoms, such as dizziness and vestibular symptoms can occur also as a result of headaches, for especially migraine type headaches, some medications, some autonomic dysregulation, and the most important, inner ear disorders. So again, sometimes when we are treating headaches or when we are treating anxiety, the dizziness or fogginess, they just go away. Or for example, I mean that, for example, some types of headaches, as I said, migraine type headaches can cause dizziness, and treating migraine can help with this dizziness. But assessment of the vestibular function is very important, and we should make sure that there is nothing wrong with the ear, or and when we are doing the brain MRI and the imaging of the brain, we are making sure that everything is okay with the brain, I mean the gross pathology, and nothing in the cerebellum, some parts of the brain which are involved in the our vestibular system. Treatments, vestibular rehabilitation, helpful, especially for peripheral types of dysfunction, and there are some types of repositioning maneuvers that can help with the vertigo, especially the positional type of vertigo, and sometimes balance exercises as a part of the physiotherapy program can help with the unsteadiness and balance issues. We usually do not have any definite medication for balance problems and vestibular problems, so there is no definite pills for that. Visual difficulties. Visual changes, they have a wide range of they have a very wide range. For example, blurred vision, double vision, eye movement problems, and light sensitivity, which is very common, and especially difficulty with some convergence deficit and difficulty with accommodation. Usually testing should be done by the primary healthcare provider, and sometimes the patients are referred to ophthalmologists or optometrists in order to make sure is nothing, what is the problem with the eyes, and the detailed history of the visual symptoms is very necessary. It depends on the type of the visual problems. For example, one of them, which is light sensitivity, which is very common and very persistent. The treatment is different, but we expect them to get healed naturally at a period of time, and prolonged. Of course, visual symptoms may require vision-specific treatment depending on the problem. Sometimes, again, when the headaches are treated, vision problems also, light sensitivity, especially light sensitivity, can be treated, and there's no more light sensitivity, especially with the migraine type headaches. And for those who are working with the screens, for example, adjusting the lightness of the screen can help them. But some patients, they have problems, especially with focusing on something or tracking the things, which is as a result of some eye movement problems and accommodation problems. Sometimes for convergence insufficiency and accommodation problems, some patients take benefit from prism glasses. So there are different types of vision rehabilitation, or they can be prescribed special glasses for reading, or prism glasses or tinted glasses, for example, for light sensitivity. And in the end, we usually refer patients to a neuro-ophthalmologist to make sure and to do a thorough eye examination. Mental health issues. Early symptoms may include irritability, anxiety, emotional lability, depression, loss of motivation, but depression and anxiety are very common in long term, and the patient may have a history, a past medical history of depression and anxiety, which can be worsened after the concussion, but we have mood issues, depression, anxiety as a result of the concussion, and as a result of the effect of the concussion over this daily life of patients. it can cause another type of the depression and anxiety. So it requires prompt treatment, and mood issues should be treated, because they can, again, they can worsen other symptoms of a concussion. But first of all, it's very important to rule out other medical issues, such as anemia or B12 deficiency, thyroid function, hormonal issues. About the treatment of the mental health issues, it's very important to be treated. So there are two parts: non-drug treatment and drug treatment. So we usually start with the non-drug treatment, including psychotherapy, CBT, doing exercises, having both physical exercises, cognitive exercises, having a sleep hygiene, good sleep hygiene, and social interactions and mindfulness meditation. But in some cases, we need to start a medication. So SSRIs are the most common medications used to treat mood issues, especially the depression, and they can help with the anxiety too. And sometimes we have to do both drug treatment and non-drug treatment at the same time. So if you're having mental health issues, talk to your healthcare provider, and sometimes it's needed to be referred to a mental health professional, psychologist, neuropsychologist, psychiatrist. So I insist again that the mood issues should be treated. Thank you very much for listening. Now we'll turn over to Dr. Rutan.
Thanks very much, Dr. Tarazi. I'm going to just talk a little bit more on the mental health issues. We were just hearing how there are really two primary treatments for mental health issues, whether it's depression, anxiety, or something else. There's medication, and there's talk therapy or psychotherapy, as well as various other kinds of self-care activities. And in the ONF guidelines, they really emphasize how addressing the mental health issues as well as pain and sleep are really, really important. And the reason why these are so important is that when any of these things are off, so for example, when someone is feeling particularly depressed, particularly anxious, it can very much impact on other symptoms, on many areas of functioning in our life. And so I wanted to talk to you a little bit about cognitive behavioral therapy. And if you look at the slide, you'll see the little diagram with the different circles. You'll see the environment is sort of the larger oval. And what this reflects is basically anything that's going on in your life changes that have happened recently, that may have happened over the course of several years, or even just, things that happened even, as a child, and the situations and environment that we have grown up in has very much shaped our brains and the way that we think and the way that we respond to different challenges in our life. Within that, we also have these smaller bubbles. We have thoughts. Those are the thousands and thousands of thoughts that we have run through our head every day. We have our moods. That's how we're feeling. Our behaviors. So our behaviors are the things that we do or the things that we don't do and avoid. Do I decide to stay on the couch and watch Netflix, or do I get outside in the fresh air and go for a walk? And then finally, we have the physical reaction. So this is what is happening in our body, our physiology. And so this includes, obviously, symptoms that you may be having as a result of the concussion. And what we know is the most important thing that I always try to emphasize to patients and clients when I'm speaking to them is that all of these things are really closely interrelated. And what that means is that even a simple thought in our head can influence our physiology. It can cause physical changes in our body. We know that having certain thoughts can impact on our moods. So often, for example, if someone is depressed, their thinking tends to be biased in sort of in a negative direction. And unfortunately, you can see how people can get into a really negative loop if they're having negative thoughts. Perhaps they've had a concussion. That's what the life situation is. It's the symptoms are wearing on, much longer than they were expecting, and they start to feel frustrated. and maybe they're not back at work or not back at school, not back to doing the regular activities that they would typically do. That can very quickly lead to feelings of sadness, irritability, frustration. The behaviors that follow from that too. Individuals that are depressed, for example, very often will engage in behaviors that may actually make them feel more depressed. So people that are depressed tend to withdraw. They may decide not to go outside, not to engage with friends, and not, be less active and take less good care of themselves, perhaps not eating as well, not sleeping as well. And of course, all the while, there are physical reactions that are associated with all of this, and they can very much feed back on one another. Where cognitive behavioral therapy comes in is really trying to focus in on that thought bubble that you see on the screen. And you can see that we sometimes term some of these thoughts that we have as thinking errors. And I think, we can all identify with these. We all do them from time to time, but depending on our state of mind and what's happening in our life, we may do them a lot more often than is healthy. And an example is all or none thinking. So this is really seeing things in black and white. If someone's performance isn't perfect, they see themselves as a total failure. If symptoms aren't 100% gone, a feeling like this is, or a thought that this is never ever going to get better. Another example is overgeneralization. So, having one bad thing happen and then just kind of giving up and throwing up your hands and feeling like, you're never going to be able to do that again. So with cognitive behavioral therapy, this is really something that you can engage with it. You can see a therapist, a psychologist, there are other mental health professionals as well. It's also something you can even just try on your own. There's a book called Mind Over Mood, and it's written as a self-help book that will actually introduce you to cognitive behavioral therapy and have you do exercises. And really the important part is to start becoming more aware of the way that you're thinking and responding to situations. And the reason why that we bring this up in the context of concussion, we have been doing research in this area, and certainly there is a lot of evidence to support cognitive behavioral therapy, not necessarily not just in concussion, but in treating a very wide range of mental health issues, also in treating things like insomnia. So it really makes sense. We feel that this could be a really good strategy for people to try out. So it may be something that you want to take a look at. There are also lots of apps that you can use, put on your phone, many of which are free, that can help you to get started on using this tool. And one of the most common tools that is used in cognitive behavioral therapy is something called a thought record. And you can do it on a form like this. You can simply download it. You can find them free on the internet and do it there. They also have them in the Mind Over Mood book, or you can simply do it on a scrap piece of paper. But this is I'm going to run through very quickly. This is the basic idea. And so you've got a situation. This person's saying it's Monday morning. I woke up with a headache, which I suspect, many people can relate to. The next column is mood. So what you want to do is ask yourself, how am I feeling? And so this person's saying, I'm feeling sad, I'm feeling anxious. And you're also asked to rate on a scale of 0 to 100, how sad, how anxious am I feeling? So this person is rating their emotions pretty high at 70 and 80%. The next piece is a really important piece and this is what we call automatic thoughts. And we all have automatic thoughts, and some people's are more positive or negative than others based on our own brain wiring and experiences. But this person's feeling like, my day is ruined. These symptoms are never going to get better. What we then encourage people to do is to really hone in and say, what thought is driving the emotion? So what is really making me sad? What is making me anxious? And this person's saying it's really this belief or this thought that these symptoms are just not going to end. Then you're encouraged to actually come up with hard evidence and facts that would say, okay, this is why I'm thinking this. If you had to convince someone, So the person's saying, this is the third time this week that I've woken up with a headache. Sometimes the headaches are so bad, I have to stay home. I can't go to work. Then on the flip side, you're also asked to come up with, if you can, is there any evidence that would argue against that thought, that would say, well, I don't know that I believe you about the symptoms never getting better. And the person's able to say, you know what, when I really think about it, my headaches aren't as severe as they were right after the concussion. And I actually do have some occasional pain-free days, which I wasn't having, a couple of months ago. And then the next column is, the idea is that you're coming up with alternative thoughts. So instead of that thought, these symptoms will never get better, they come up with, well, I still get headaches, but they're not as frequent and severe as they once were. I still experience symptoms of concussion, but they are slowly improving. And then what we do is we ask the patient or client to rate how much they believe that. Because obviously you can come up with these things, but if you don't have a belief in it, it's not going to be helpful. In this case, the person is rating their belief at 85 and 70%, which is pretty good. And then at the end of the exercise, you're asked to re-rate the mood. We don't expect that doing one thought record is going to suddenly take away this thought, that you're never going to have the thought again. But our hope is, even in doing the exercise, that it may bring the intensity of the emotions down. And just like, we have talked about before, that there really is no magic pill that suddenly makes things go away. We do know that with practice, and as you start to do this repeatedly, you can start to kind of rewire how you think and the patterns of your thoughts, and so that automatic thought is starts to lose its intensity, and you're able to sort of view things from a more balanced perspective. The other difficulty that sometimes people will report after concussion is difficulties in their thinking or cognition. And some of the common things that we often hear are people having difficulties with their attention, with their learning, their memory, their speed of processing, their decision making. I often have people say that they feel foggy, that they just can't think through things, as well as they did before. We also know that certain people may be more vulnerable to these kinds of problems. So if a person had a pre-existing learning disability or ADHD, um, uh, quite possible that they may struggle a bit more. Certainly, it's also important to remember that mood issues, sleep issues, so if someone's not getting restorative sleep, or if they're walking around with a constant headache, that it's not surprising that cognitively they may have more difficulty. It's pretty difficult to focus very long if you're sleep deprived, or if you're in a lot of pain, or if you're depressed. So that's why, as I was saying earlier, it's really important that those symptoms are addressed, to see, okay, if I start sleeping better, or if my headache pain is managed better, am I seeing that I'm actually able to pay attention better, to remember better, to process information better? Generally speaking, we expect that cognitive difficulties will resolve post-concussion within several months. Um, if, in terms of what to do, one of the most important things is just being educated and knowing that cognitive difficulties can occur after a concussion. And also knowing, just as I said, that there are a lot of different reasons why people may be having cognitive difficulties. So it can simply be as a result of the concussion, or it could be, because I'm, maybe taking some medication that is interfering with cognition, or I'm in pain a lot, or my sleep has been very disrupted. Um, we know that um, techniques like mindfulness meditation, cognitive behavioral therapy, again, can be helpful for things like sleep and even pain. So we know that the more of these tools and strategies that people are able to engage in, that may help. Certainly also using compensatory strategies. So for example, if you're having memory difficulties, there are a lot of different tips and tools that you can use that can help to compensate for your memory. Writing things down, keeping, setting alarms in your phone or on your computer. Now, if cognitive symptoms are not resolving and you're sort of taking care of all of these other things, you're sleeping well and your pain is well managed, and you've talked to your doctor about your medication regime and so on and so forth, and you're still really noticing cognitive difficulties, then referral for a neuropsychological assessment may be warranted, where you actually go in and undergo a formal assessment to try and decipher what's going on. It's also really important to continue to stimulate yourself intellectually. This is true for all of us, whether you've had a concussion or not. But certainly when people have had a brain injury, especially if, for example, you're not able to return to work right at this point, really good to keep your brain engaged. Just like, we don't want to see people shutting down physically and doing no active exercise, we also want to keep mentally active. Now, mindfulness meditation is a tool that we have referred to a few times and spoken about in previous sessions. This is another tool with limited evidence in concussion per se, but certainly a growing body of literature generally to suggest that it can have really positive effects on our mood, on our thinking abilities, on our stress levels, on mental health issues, and overall quality of life. And there have been a number of interesting studies as well, actually looking at actual changes in the brain in people who meditate on an ongoing basis, whereby we actually see changes in the brain. So, this is a good example of what we call brain plasticity or neuroplasticity. So, which is really encouraging for all of us, because what it says is, with practice, just like anything else that we practice, there is that possibility to get better and to boost the positive effects that come with it. They have also found that there can be a positive effect on mental fatigue and on tests measuring information processing speed and attention uh, for those that engage in this. And when I talk to patients and clients, they're often very reluctant. I think, as I was when I first stumbled upon this many years ago. But mindfulness meditation does not mean that you need to sit in one spot for long periods of time and clear your mind. I think that is a common myth. And I often have people say to me, "Oh, I can't do it. My mind is just busy, busy, busy. It's racing all the time." And I always like to reassure people that that is the case for everyone. And what I will often encourage people to do is even just to take a minute or two a day, whereby you shut things down, and it can be as simple as even just taking some deep breaths and or simply going for a walk, ideally in nature around, in green space. Or it can simply be sitting down, shutting down your phone, your computer, and listening to a sound, or focusing, putting both of your feet on the floor and bringing your attention to your feet. What you're really trying to do is bring your attention to the moment, because most of the time our minds are very busy worrying about something that we've done, worrying about something we have to do, and we're not actually right here, right now. And it's not to suggest that we can all walk around doing that all the time, but even taking a couple of minutes a day, and ideally making it a habit. So, setting an alarm. There are all kinds of free material on the internet. There are free apps, really good ones that you can put on your phone, where you can actually listen to a short guided meditation. And we have a list of a few of those at the end of the presentation. Another aspect, just in terms of good self care, which is what we encourage people to do when they're recovering. Um, Important for all of us, but when you're recovering from a concussion, you really want to do everything possible to maintain a healthy environment for your body and your brain. Diet and nutrition falls into this, and we don't recommend any one superfood for your brain health. Um, Probably one of the best things you can look at is at Baycrest. They put out a Canadian brain health food guide for adults back in March of 2017, and you can find this online. And it makes a number of recommendations of things that you can do in terms of your nutrition and diet. Uh, but really, in the end, you're wanting balance, moderation, and a varied diet. Alcohol and recreational drugs is something that we are frequently asked about. We generally encourage people to avoid these after concussion, especially while you're still symptomatic. Your brain is really quite vulnerable, and the last thing we want to see is someone, drink too much and then fall down and re-injure themselves. There are also yeah, a small risk of potential seizures, of slower recovery. And then the other thing is, these substances can also interfere with some of the other difficulties that you might be having, like your sleep, mood, thinking difficulties. So, for example, we know alcohol is a depressant, and while it can help us fall asleep better, it actually disrupts the sleep process. So, you may find that you're waking up and not actually getting the restorative sleep that you need. And physical exercise. So here's another tool, and here's one that really has some good evidence behind it. Again, we all know that physical exercise is really good for us. Aerobic exercise increases something called BDNF, which is brain-derived neurotrophic factor. And this is something in our brain that supports the survival of neurons, encourages growth and differentiation of new neurons and synapses. So definitely something that you want to foster in the brain. It also increases endorphins, which are sort of those feel-good things that are generated when we exercise. We also know that physical exercise has positive effects on our thinking abilities, our mood, our stress level. And there's also some evidence to suggest that inactivity may actually worsen symptoms. So it used to be the case that people post-concussion were advised to, stay in a dark room, not be active, and so forth. And we've now learned that that is actually really not the thing to do. In fact, you really want to start to get going gradually after an injury. So low-level exercise is, for those that are slow to recover, really may be of benefit. And the University of Buffalo has been doing a lot of work in this regard. So if you're interested in reading more, you can go to their site. And at this point, we're going to move to the question and answer session with Dr. Tatter. I had a concussion 3 years ago when I was rear-ended on the highway. It was my first concussion. I still have light sensitivity and my job is screen-based. Every time I am working on the computer, I get dizziness and headaches and have to stop working. Is there any specific treatment for light sensitivity?
Thank you for that question, Leslie. Yes, the good news is that we have gradually figured out some of the problems that light can cause. And this is a very common problem with people recovering from concussion. Probably 25 to 30% of people have significant light and screen sensitivity of one type or another. And fortunately, there are a number of strategies. For example, we now know that there are certain cells in the retina, that is the nerve cell layer at the back of the eye, can give off messages directly to pain sensitive structures in the brain, so that some patients are extremely sensitive to light after concussion. And in fact, they even startle or wince when a bright light is in the vicinity. So pain from light, and that can be treated with glasses of a definite wavelength. For example, the blue light, the blue end of the spectrum, can be eliminated, and that's one of the most light sensitive parts of the spectrum of light. So changing your sunglasses from gray or dark brown or green to orangey and light brown make a huge difference. So if you visit an optometrist, most of the optometrists nowadays are very clued in to which colors need to be filtered out by sunglasses. So that's a very important aspect. Another is to try to change the brightness of a screen, for example. We call it screen intolerance, and so many of us now are working in front of computers for even hours a day, and some people's job totally depends on computer use for 8 hours a day. And that can be very aggravating. And fortunately, most computers now have brightness controls, so you can turn down the brightness. And even just doing that can make a difference. You can change the color on your cell phone or computer by using specific programs. So for most computers, f.lux is the program to apply to your computer, which will change the color and reduce the brightness. For cell phones, there's often a nighttime application that can be used daytime as well to, again, change the color and reduce the brightness. The size of the sunglasses can be also important. So what I call the Elton John orange sunglasses can be very effective for reducing light coming from different directions, because they're like insect sunglasses that cover a large part of the forehead and face to reduce light. And then finally, TV screens and most cell phone screens are LCD, which stands for light liquid crystal display. And with that type of screen, there's always a flicker. And normally our brains, especially this part of the brain, fuses the images so that we don't see the flicker. But every computer screen of that type, liquid crystal display, will have this flicker. And sometimes the flicker is at 60 hertz, which means 60 times a second the image changes. That's a lot of work for your brain to fuse those images. So using an e-reader, for example, instead of a computer, if you're having to work in front of a computer, if you can change at least some of your work to an e-reader screen, like a Kindle or Kobo, will prevent that aggravation of the brain due to flicker. So in summary, there are a number of strategies that can be used to help with photosensitivity and light or screen sensitivity.
So our next question is on CBD, or cannabidiol. I've been using CBD oil and find that it has helped with my headaches and anxiety. Is it safe to take regularly, and are there any risks to my health?
Well, thank you for that question. And unfortunately, we do not have all the answers, because it's only recently that we find a lot of people coming forward and saying, I'm taking CBD oil, and does that really matter now that I've had my concussion? Many people find that it does improve headaches and anxiety and stress, and they take it for medical reasons that are valid, and we do not feel that it's a problem if taken in moderate amounts. So in other words, if you need it to get to sleep, or if you're having a particularly anxious moment because you're returning to work or whatever. So we don't ban taking um, marijuana derivatives the way we used to. We now see that there are some positives, but it's very individual, and we don't really want to go to the point of using it as a an overall therapy for concussion management. In other words, not everybody should be taking it. And the dose of it has to be regulated, because we have people come to us who admitted that they are addicted to CBD and they can't stop taking it. And in fact, there are some who have to actually escalate the dose of CBD to get the same effect that they got 6 months ago when they first started taking it. So, we call that habituation. In other words, you become used to the drug and you have to take more to get the same effect. And that's the way narcotics are. So, in my view, there's like I see people who are actually addicted to CBD and can't get off it, want to get off it and can't get off it. So, you have to be aware of these issues with CBD. But if you can take small amounts, and if you don't have to increase the amount, and I see no problem in taking it. We are not really aware of any significant risks to health apart from what I've already mentioned. I do not think that it is an established treatment for concussion. So if somebody comes to me, it's not one of the drugs that I routinely recommend, but I'm not going to tell you to stop, especially if you find that you're having benefit from it and you're not addicted to it.
Great. Thank you. The next question is about dizziness. I have a history of 3 concussions, 2 that occurred while playing hockey, and the last one 3 months ago when I fell off my bike. I now have dizziness while driving or when I turn my head to the side. How long will this take to improve, and is there any good treatment?
Well, there's a whole bunch of good issues in that question that I would like to cover. First of all, dizziness is an extremely common symptom after concussion. And in most instances, it just gradually goes away, but in some it doesn't. And specific treatment, such as was mentioned earlier on this program, is required. For example, repositioning and advice from a vestibular physiotherapist or from an ENT doctor who specializes in dizziness. What worries me about this particular question is the fact that this dizziness is of a specific type that we recognize. In other words, there is a positional feature to it, that it can be precipitated by turning the head. So that to me means that it is most likely an end organ problem, which means in the inner ear rather than in the brain. There's a good suspicion here that the problem is in the inner ear, and leading to this dizziness that is precipitated by movement of the head makes me worried about an activity such as driving. Because imagine if you turn your head to see a car that's approaching from the right or from the left, and you get dizzy, you're going to lose control of your car. So anyone who comes to my office and says that while I'm driving, if I look to the right or to the left, I get dizzy, my response is do not drive. It's too risky to drive. And you should seek explanation for the type of dizziness you have, and you may require specific treatment for it.
Great, thank you. Next one is about sleep. My concussion was several weeks ago, and I am still having a lot of trouble getting to sleep. Is there anything I can do?
This issue of sleep problems, especially this particular type of sleep problem, is very close to me because this is what happens to me very often, that I can't get to sleep. So I'm going to give you the Charles Tatter approach to getting to sleep, and it involves meditation. And my personal best meditation is to think of a very pleasant activity. And for me, it is going on a trip to the North Country. And so I think about all the details, packing my suitcase, packing my food, putting in my paddle, making sure that I've got my fishing rod, for example, and then how I put it in the trunk of the car, backing the car down the driveway, which road to follow. And before I get a few miles done, I'm asleep. So try that. Now, if that doesn't work, if meditation doesn't work for you, then there are many other strategies. For example, I readily recommend melatonin. Most people don't take high enough dose. So when you go to the drugstore, because it's an over-the-counter medication, you can get it in doses of 1 milligram, which is useless in my view. You can get 2 milligrams, 3 milligrams, 5 milligrams. So I usually tell people start with 3 milligrams, and if it doesn't work, double it. And if that doesn't work, go up to 10 milligrams. If 10 milligrams doesn't work, it's not going to work for you. Don't go higher than that. It's a very safe medication. You know, it is a herb of some sort, and you won't get addicted to it. And it usually doesn't have any significant side effects, maybe daytime drowsiness. You may have to juggle the dose a bit, but it is effective. And if that doesn't work, then you're going to have to think about going to a therapist or going to a physician for greater in-depth analysis of what your sleep problem is. You know, you should, try to do all the things that were mentioned earlier, like making sure you have control of caffeine. Caffeine after 12 noon is a sleep problem. So if you're going to sleep 9, 10, 11, or 12 o'clock, no caffeine after 12 noon. Caffeine is a terrible disturber of getting to sleep and staying asleep. So going to a doctor or other healthcare professional to see if there's a possibility of sleep apnea, for example. That's a very important aspect of sleep hygiene. So sleep problems can be managed.
Great, thank you. The next one, so this is something we commonly hear about, returning to work. I've been off work for 2 months after suffering a concussion. My employer is getting impatient for me to return to work, but I don't feel ready. What should I do?
This problem of return to work is a major issue for a lot of people getting over a concussion. And one of the big points to get across is that we regard return to work as part of the therapy. We do not regard work as the enemy. Work is what the brain likes to do in almost all people. So work is a friend, it's not an enemy. but the dose of work has to be regulated. And we call this graduated return to work. And this is a good example of why we need individualized multidisciplinary care in concussion management. And here we often consult with an occupational therapist, for example. They are excellent at figuring out what dose of work you can handle. And by dose of work, I mean anything from starting off at an hour a day or 2 hours a day. If you can't last an hour a day, you might as well just stay home. But once you can do about 2 hours a day, then it's worth going to work. You know, we're talking about non-COVID times. I think if you can work an hour a day at home, then that's fine. But if you have to go to your place of employment, then we have to add the stress of getting there and the stress of getting home. That's all part of the return to work dose. And occupational therapists are very good at figuring out what dose you can offer, that you can do. And most employers nowadays are clued into this, that people should not wait until they're 100%. Of course, it depends on the type of job you're doing. For example, if you have to do construction work and you have to climb ladders and get onto roofs and whatnot, then you're in a high-risk job and you really can't go back to that job because of the risk of another concussion. You must not go to work in an environment in which you can sustain another concussion. But if it's a concussion-free environment, then the return to work can be earlier. But even even there, someone who's in a high-risk job may be given a low-risk job when they plan it out with the help of a therapist and with the help of the employer. We find nowadays that employers are much more clued in to the problem of concussion, that you're often speaking to someone who's knowledgeable about it and understands that it has to be on a graduated basis and it has to involve what we call accommodations. That word accommodations means a lot. And it means that the work environment has to be suitable for your return. So we just handled the question of light sensitivity. That is a major issue with return to work. Because if you're working in an environment with bright fluorescent lights and a lot of noise, for example, there's no way that you can handle that when you've just had a concussion. So these accommodations in terms of lighting, in terms of seating, in terms of the noise, in terms of the risk, etc., all have to be carefully examined in the return to work process. And again, occupational therapists are expert at helping figure out the best pathway for a given concussed patient.
Great. Thank you. And here's a question on multiple concussions. I'm 19 years old and had my fourth concussion while playing hockey 5 months ago. I'm still having headaches that can last up to a week, go away for a couple of weeks, and then return. My doctor prescribed amitriptyline. It helped with the headaches, but then my sleep got worse, so I stopped. What should I do now?
That is a very interesting story. It's a story that is worrisome in a number of respects. For example, you're only 19 years old, you've already had 4 concussions. it's already taken you 5 months to get to where you are, and you're still symptomatic. So all of that adds up to strong advice from me that, for example, you must not return to hockey until you are completely better. And in fact, some people would say, look, if you've had 4 of them already and it's taken you 5 months to get to where you are, maybe you need to hang up your skates permanently. But that's a different issue than what the person is asking, because asking specifically about his headaches and sleep problem, and also the fact that he did benefit from amitriptyline. This drug is one of the most commonly prescribed drugs for people with these two problems: the problem of headache and the problem of sleep, because amitriptyline is one of the few drugs that has two major benefits for headache and for sleep. So it's commonly prescribed, and we're very careful about the dose. We try to give the least effective dose. But maybe this person needs an escalation of the dose to handle the both symptoms that he has. So it did help with the headaches, and maybe he's only taking 10 milligrams or 20 milligrams. Sometimes we have to go to 50 or 100 milligrams of this drug. Just as with all drugs that affect the brain, it's very individual about the dose. A tiny dose may be effective for some people, and other people may require quite a large dose. So the individual variation factor is very strong with drugs like amitriptyline. So probably the first thing I would do is, make sure that there isn't an additional sleep problem, like sleep apnea, for example, can occur. That's something that should be considered in this person. But if that isn't the case, I might increase the amitriptyline, especially if the person was on a lowish dose. I might increase the dose of amitriptyline. So this is a complicated question and would have to be managed sort of stepwise, trying one thing and thinking of other strategies that could ultimately help. But certainly those two problems, difficulty with sleep and difficulty with headaches, are a good example where amitriptyline is useful.
Great. Thank you very much, Dr. Tatter. And one on fatigue. I've been suffering from severe fatigue on a daily basis, and I am now 10 months out from my concussion. I've just started university and I'm struggling to keep up. Will this improve? Is there anything I can do to help? Any medication I can take? Should I drop some of my courses?
Well, this is also a great question because it is common. In other words, this constellation of issues is very common. Students at university, for example, or high school or college who have trouble managing the stresses and strains of learning also require accommodation. So, for example, this patient should have very definite advice to only take as many courses as they can handle. Now, it's very difficult for some students because of they want to achieve, they're at university for goals, and to have to drop a course or two can be very devastating. But often it's very necessary in order to deal with the symptoms of concussion, and it's not rare at all to continue to have symptoms at 10 months. I think the question, will they improve? For sure, there's going to be some gradual, continuing improvement. Can they do anything to help? Yes, they can do a lot of things to help themselves. First thing would be to deal with the dose of school. Just like in the last question, we were dealing with the dose of work. Now we're dealing with the dose of school. So dropping courses, readily drop courses if you cannot handle the load. Get some assistance. Most schools, whether it's high school or university, do have healthcare professionals available to weigh in and help juggle the many issues that are facing students. I would think that all of that should be looked at before resorting to medication. But once the diagnosis is made of exactly what is the reason for inability to take a full course load, is there a cognitive issue lurking in the back that recent memory is a problem? Is it interference? Is it light in the classroom? Is it too much noise? All of these are issues. I think that the idea of taking medication should be at the end of trying to deal with all the other potential remedial issues that are facing this student. In terms of the fatigue itself, that symptom, unfortunately, is one of the most difficult to treat. It is a fairly common symptom of concussion. Sometimes the most predominant symptom, but that's less common. But it's often lurking in the background, accompanied by headache and dizziness, and some of the more common symptoms. But fatigue is common and sometimes needs specific attention. Making sure you get enough sleep at night. Do you have undisturbed sleep? That's very important. Are you taking too much caffeine that's interfering with sleep? Exercise is very helpful for people who have fatigue as a prominent symptom. So we mentioned the importance of daily physical exercise. The type of exercise is important. So it should be non-impact exercise. In other words, jogging is not good, but fast walking is excellent. Stationary bicycle, excellent. So that type of physical exercise, daily physical exercise, working up to 30 to 45 minutes, 7 days a week, should be on the prescription for dealing with fatigue.
Great, thank you very much. Okay, that's the end of the question and answer session. Thank you very much, Dr. Tatter. We hope that everyone has found this session helpful. If you want to see more, you can see a full concussion education and support workshop that we had previously recorded, and you can find that at the Canadian Concussion Centre website if you click on the patient support tab, and that's where all of the videos that we have done can be found, and you can view them. Just in terms of some additional resources that you may find helpful and that have been mentioned, the Ontario Neurotrauma Foundation has specific patient resources and a patient handbook. Concussions Ontario also has information for both patients and healthcare providers. And the Baycrest Brain Health Diet that we referred to can be found as well at that link. In terms of the mindfulness meditation resources, here's some apps. Again, we don't endorse any of these specifically, and most of them have a fair bit of free content, some more than others, but that you may find helpful in getting started in adding that particular tool to your toolbox. Thanks very much.